دكتور ياسر،
هلا.
بنبدأ خلال أقل من 4 دقائق بإذن الله.
اوكي، على بركة الله.
يعطيك العافية. دكتور نزل الكام شوي الله يسعدك. ممتاز. دكتور نبدأ.
يلا بسم الله. Okay, Bismillah ar-Rahman ar-Rahim. I would like to welcome you all participants. It will be my pleasure to be with you, inshallah, today as Dr. Saoud Al-Umar will join us. My name is Yasser Al-Mazrou. I'm a senior clinical psychologist and the director of medical scholarship program at the Ministry of Education. As Dr. Saoud Al-Umar, inshallah, will join us and he will speak to us today, inshallah, about mental health of healthcare providers, luxury or necessity. Dr. Saoud Al-Umar, he's a pediatrician and adolescent medicine consultant at King Abdullah University Hospitals, at Prince Noura bint Abdul Rahman Universities. He's a well-known chief well-being supervisor at the universities and also chairman of the well-being committee at the university. He's a founder of DAAM, which is a program that provided by the Saudi Commission for Health Specialties, and also he's a chairman of Consultants Advisory Committee of the Trainees Wellbeing of DAAM. Also, beside that, he's a founder of many other workplaces well-being programs. I would like to please welcome Dr. Saud, and I wish you an enjoyable session with us today. Thank you. Go ahead, Doctor.
Assalamu alaikum wa rahmatullah. I hope my voice is clear, and welcome everyone. Thank you for the Saudi Patient Safety Center for inviting me to talk about this very important topic. As I'm one of the healthcare providers, so we are sharing maybe the same concern and the same issue. Before I proceed, just also would like to thank the WHO Collaborating Center on Patient Safety, Policy and Strategies for also organizing this talk. Just before I proceed, we'd like to know if my screen is clear to everyone and my voice, also my cam is on. So before we proceed, is the voice and everything is clear to you? I didn't get any response so far. So is my voice and the presentation is clear? I hope it's doing is hearing my voice because
دكتور الصوت واضح.
okay. So so there is no disclosure. This is our objectives of our talks today. Just we will talk about the well-being concept definition and also about what is the impact of burnout and why we are concerned. And also we'll talk about antidote for burnout on personal and institute level. Actually, a key component of individual mental health is the ability to adequately fulfill his or her roles, including the capacity to work. Well-being it's a combination of feeling good and functioning very well. It's and the mental health it's defined by not the it's more than the absence of mental health disorder. WHO, they define the well-being as a state of mind in which an individual is able to realize her or his own abilities to cope with the normal stressors of life, can work productively and forcefully, and also able to make a contribution to his or her community. So it's not just the absence of disease, it's the ability to cope with the stressors. We have a lot of stressors in our life, in our home, at our work. So are we able to cope and handle these stressors or not? And also to have also a good feeling. What is our feeling? What is our relationship with others? How we contribute to our community? Mental health like depression, anxiety, stress, they are very, very common, affecting individual, their family, workers, co-workers, and broader community. And as you know, after the COVID-19, most of the numbers of depression, anxiety, either in public or even in the workers and employees, it has doubled. Like, for example, the anxiety, some studies, they say that it's more than double than before. Some studies, they say it is triple than before COVID-19 in public and also in employees. If we are defining, or just to talk about what is the definition of burnout, burnout as defined by as a syndrome resulting in chronic workplace stress that has not been successfully managed and generate insufficiency in organizations. So it is a kind of stress related to work, and it has three main domains. The first one is sustained feeling of exhaustion. The person, they will lose their energy, depleted, overexhausted, fatigue. And the other component of burnout is depersonalization, where the person starts to withdraw, increase mental distance from one's job, also feeling of negativism, cynicism, and related to his or her job. The third component of it is emotional insufficiency, where there is reduced feeling of accomplishment or productivity, or the person believes about his own ability to finish his work. So day by day they have more load, more work, then they will start to distance from their work. They will lose productivity. They will lose also trust in their ability. Burnout actually has drawn more attention and importance in the last decade. If we look from 1970, maybe there was, I couldn't found any paper related to burnout, but after that start to have some papers and some research concerning or concerned more about burnout. Till in 2019, it is more than 2,145. In 2022, it was almost around 3,450 something. In this year, 2023, it reached almost near to 4,000. Still, we are maybe just we are in the second half of 2023. So the concern and the people, they are more concerned about mental health, about burnout, so to draw more attention year by year. How big is it? There are many studies, and it depends on the scale they use, about the population, the kind of job, and the definition, how they define the burnout, the degree of burnout. Is it mild? Is it moderate? But generally, we generally say that more than half of U.S. physicians experiencing substantial symptoms of burnout. And according to one report by Shanafelt, there is approximately one physician commits suicide each day in the United States, which is more than the general population. This is before, as we said, COVID time. This is like a collection of some of the recent studies, either in medical field or non-medical field, also in some of the studies here in local. let's start with the CDC in 2022. They surveyed 26,000 US public health workers, and they found approximately half of them experienced at least one symptom of mental health condition during COVID-19 pandemic, including anxiety, PTSD, or post-trauma stress disorder, depression, and 1 in 12 experiences suicidal thoughts. There is one study done in Vancouver in a telecom company or tech company. They raised they said that the tech sector has never seen a mental health issues as prevalent as right now. Another study in 2022, which involved like almost near 500 participants from 6 different corporations, from business, real estate, insurance, property management, and other studies. They found that 60% they have burnout. One study in our country, in the telecom company, they found that also there is a lot of stress, burnout with different factors. We did one study in 2019 on the medical trainees, and we found that 56% has burnout, but it's different with different severity. This is another numbers related to mental health done by Mindshare and partners. They found that mental health challenges are near universal. It's like 76% reported experienced at least one symptom of mental health. Also, they found that 84% reported at least one workplace factor that negatively impact their mental health. Another numbers also, like 60% of the work population, they are in work. 61% of workers work in their informal economy. 207 million unemployed people are expected in 2022. They found that 301 million people lived with anxiety in 2019. 280 million people lived with depression in 2019. Also suicide, what's the impact? 50% of the total societal cost of mental health condition is driven by indirect costs such as reduced productivity. And there are many ways to measure productivity, either through some scales or through absence, or through decrease direct productivity, even if they are attending every day, but their capacity to work is less. Also, this burnout, how much it cost? It cost $1 trillion US dollar cost to the global economy due to depression, anxiety, and predominantly from lost productivity. Usually, okay, this is about what's the magnitude, how much the burnout. But if we are talking what are the causes of burnout, there are many causes and many approaches. But maybe one of the most well-known approach is to know or if there is imbalance between job demand and job resources. What we mean by job resources, like culture, job control, relationship, and social support, meaning at work and rewarding. Do the employees have any meaning at work? And the demand, like excessive workload, administrative burden, workflow interruption, and some clients and personal factor. Moral also distress, one of the demands. There are other drivers like control and flexibility, work-life integration or work-life balance, social support, and community at work. All these. There is also the top 5 top factors. Employees in 2018 identified 5 organizational factors for burnout. First one is unfair treatment at work, unmanageable work load, lack of role clarity, and role ambiguity. Sometimes some of the employees, they say, I don't know what's exactly my job description. I don't know what should I do. Sometimes I take task that is not under my responsibility or under my interest or under my specialty, I have no extra capacity or skills to handle such job. A lack of communication and support from their managers, and this is one of the very important factor, because if you have a supportive manager, it is one of the resources that will help you to decrease your level of anxiety, level of burnout and stress. And we see it very clearly in COVID-19 that year. Those hospitals with a good leaders, those who are supporting their employees, they have much less burnout than those without support. Unreasonable time pressure, also one of the main causes. If you can look at this one, there is no one mentioned the salary or money. So yeah, I know money is very important, but it is not the most important factor. There are many important factors other than money. Workplace politics and can be associated with higher risk of burnout, depression, coronary artery disease. What are the physical symptoms? We can go through it very quickly. Like physically, they will be tired, drained, lower immunity because of persistent high cortisol. Their immunity will be lower. Frequent exchange in appetite and sleep. Emotionally, they will have sense of failure, self-doubt. They have diminished self-accomplishment, helplessness, defeat, detached, increased isolation, increased cynicism, decreased also satisfaction. Behaviorally, they start to withdraw, procrastinating, self-medication, and skipping work. We need to protect the workforce that serve our clients. What is the impact of burnout? Impact, it is on 3 levels: on the individual, on the company or organization, and on the clients. For individual, they might have cardiovascular disease, hypercholesterolemia, type 2 diabetes, musculoskeletal pain, prolonged fatigue, headache. On the company, they might have more absence, and it was mentioned that almost 35 to 45 of absence due to mental health in UK, and more than 5 million lost days per year in the UK. Unprofessional behavior, sometimes hostility, poorer quality of care, decreased productivity, staff turnover, early retirement, resignation. For the clients who is like receiving the service, they will have a drop in client satisfaction, affected employee-client relationship, hostility, more professional or medical error. This is in another explained more for the organization. They will have more attrition rate, and this is one of the measures that they can use it to measure the productivity, turnover, lower productivity, impaired work quality, and all these things, interpersonal and individual, all we talk about. Okay. Again, this is one of the impact that employees are leaving their job for their mental health. 50% of full-time US worker, this is again from Mindshare, 50% of full-time US workers have left a previous role due to, at least in part, to mental health reason. This number rises to 81% of Generation Z respondent, in millennial respondent 68%, 32% when considering voluntary departure. Productivity loss, 70% or 72% of on average, worker reported performing at 72% of their full capacity in the past year when considering their mental health. That means their productivity decreased by 30%. Absenteeism is on the rise also. An average respondent missed 8 days due to mental health disorder. One study, they said that depressed person, they lost at least 6 to 8 days in the last 3 months. Again, productivity, per year, depression resulted in average 44 working days loss for each employee, those with depression, 42 with heart disease, 21 for asthma, and 39 for those with lower back pain. So it is very clear that mental health issues on the rise and affect more. Why we care? If you ask me at a personal level or in our country, we are, everyone in his country, I'm sure they are interested and they are concerned about the mental health of their employee. But let me start in our country, why we are concerned. We have a vision country, Vision 2030, which focus on quality of life and improving worker and citizens' health. And also in our Ministry of Health Workforce Initiatives, they are focusing more on well-being. And one of the comprehensive few components that to promote the workforce physical and mental health well-being and decrease burnout. For everyone to why we should be concerned and why we care about our employee and why we want to promote their mental health, to lower risk of malpractice, improve client satisfaction score, increase productivity, improve quality of care, and improve the communication with co-worker. Also to reduce the cost on the company system. The cost of mental health disorder, for example, at one Canadian university amounted to be 3 million for each for the year in 2001, which is almost, we are talking about 22 years ago. 40 million workers in 15 countries of the European Union have work-related stress, costed 20 billion euro annually. So where is this cost come from? It comes from two direct ways, from two ways, either direct or indirect. Direct from absenteeism, recruitment expenses, insurance coverage, disability payment or medication or visits. Indirect from loss of productivity, replacement, payroll, training expenses. What about the intervention programs? Is it cost effective? Yes, it is cost effective. They found in the cost analysis indicate that for each dollar invested in wellness and well-being, there is $3 to $6 return on investment. Johnson & Johnson leaders estimate that the wellness program have cumulatively saved company around 250 million on healthcare costs over the past decade, from 2002 till 2008. And the return was about 2.7 for each dollar spent. Why we care? To improve satisfaction score, to increase productivity, to improve patient quality of care. What are the benefits of positive mental health and well-being? Better physical health, including induced risk of heart disease and stroke, higher educational attainment and increased employee prospects, enjoy life more fulfilling relationship, better quality of life, and increased longevity, better able to cope with the challenges, with the stressors, feeding more confident and positive, healthier behavior and lifestyle choices. All healthcare providers, either physician, non-physician, dentist, medical student, nurses, pharmacists, paramedical, all healthcare workers, staff, hospital worker, they are precious resources and should be assisted to work at the top of their license and training. Many professionals, actually, they are reluctant to acknowledge that they have a problem. And here's the problem. Sometimes when they feel just some low level of or mild level of burnout, they don't seek help. They continue to overload and to receive more work. They don't take any off, any vacation. They don't take care of themselves, and also they don't take care of their health, their mental health. So they might end up with bad and severe burnout. There are some national and international examples. Some of them, they are very for a long time, and we started nowadays to see more interest in many companies, either in medical and non-medical field, but we'll those are some international examples, and there are some national examples. I will also talk about one of them. For example, like international example, Google, Stanford, Johnson & Johnson, Intel, Starbucks, all these, they have wellness and well-being programs, which is they are putting mental health of their employee as a priority. What about locally here? We have DAعم program, which means in Arabic supporter. It is one of the largest healthcare provider well-being program for all healthcare provider across the kingdom, which is almost, we are serving more than 600,000 healthcare providers and more than almost 20,000 trainees. It started, we initiated the program in 2017. It was launched in 2019 and it was expanded. Initially it was just for trainees. Then we expanded that program to involve all, or to help or to serve all healthcare providers in the kingdom, either in the government or private sector, Saudi or non-Saudi, all healthcare provider, whatever their specialty, they can benefit from this service. It has many area or domains. We have like needs, we did needs assessment, we have trained the trainers, we have also some online self-training module. Also there is counseling session, which is free and confidential for all healthcare providers. It provides academic and psychological support, train the trainers. We designing, also creating educational content, conducting national survey, and we are enabling the training center to establish well-being services through a framework and policy that has been done a year ago. This is some feedback from our trainee and healthcare providers, those who received the service, that their feedback and satisfaction rate was very good. 91 of them were satisfied, 4% was average, and 4 was dissatisfied. And most of those who are dissatisfied, mainly because we are just providing a psychological and academic support, but we don't like some of the requests, it's out of the scope of service. So how we can create and well-being programs at our institute, or how to help healthcare providers, we will just discuss 2 levels. One at individual level, what you can do to care for yourself, and also what about the institute, how you work for institute. So what we can do at personal level. There are a whole range of ways that can be improve our well-being and resilience. First thing, we have to connect and keep our relationship with our friends, with our family, supportive. They are those are supportive, colleagues, neighbors, at the school, at home, at wherever in our local community. So building these connections will support and enrich our day, and help us also in our bad days. Be active, go for walk, for run, step outside, cycling, play game, whatever, any kind of activity. So to do it, if you can daily, that will be great, but at least 3 to 4 times a week. Take notice, be curious, catch of the sight of beautiful, doing mindfulness, yoga, whatever, any kind of biofeedback activities. Give also something nice for others, for friend. Volunteerism is a well-known source of happiness, and it will help and improve your mood and emotions. Personal resilience, increasing hope also among employees. This one, it will improving resilience and increasing hope also will help to decrease burnout. Keep learning, other hobbies. Other strategies: optimal nutrition, avoiding toxins like tobacco and alcohol, misuse of prescribed medication, balance of exercise, which is very, very important to have exercise embedded in our daily life, at least 3 to 4 times a week. But if you can do it every day, it will be great, and I'm sure it will make a big difference in your mood and in your general health. Sleeping also, one of the things that we suffer as a clinician or healthcare provider is we have lack of sleep deprivation. So most of us, they say, okay, it will be enough for me 2 or 3 to 4 hours. I'm sure this is not enough. It is maybe enough just to keep you awake and to do your work at minimum of your capacity, but to do a full capacity or to have full capacity and full energy, you need to sleep at least 7 to 9 hours. Healthy, supportive relationship with family, friends, neighbors, colleagues. Also meaning, purpose, and connection with someone greater. Meaning at work is very important. What is the mission of your company? What is the goal? What is the vision of your company? Are you engaged in the meaning of the work that you are doing? And this is very important. The next part, maybe this is the last part that we are going to talk about, like maybe for next 10 minutes, then we will open the floor for questions. What we can do at institute level: make mental health strategic priority, enable sustainable work model, improve access to resources, create a supportive growth environment, eliminate toxic workplace behavior. And toxic workplace behavior, it has been reported by many employees that is one of the things that push people to resign or to leave their workplace. So it's any kind of toxic work behavior, either bullying, shouting, yelling, any kind of violence, harassment, whatever. It is very important to eliminate this toxic behavior. Eliminate stigma around mental health. Many healthcare providers, they are reluctant, maybe because of the stigma, maybe because of if you have like a supportive or well-being or wellness clinic or mental health clinic, maybe the setting and the design and the location of your clinic or counseling area, maybe there is like sometimes there is a reception, sometimes there is no confidentiality, sometimes the waiting area, sometimes the access to that clinic. We have to make a very good setting and setting that help people to access these services. And one of the things that help eliminate stigma is the involvement of a stakeholder, of the leaders, the importance of mental health at work. If they always speak mental health at work, the leaders, and it's if this is, for example, the leaders and managers, they have they understand about the importance of mental health, and if any of their employees, like he has some mental health issues, and they support them to seek help from psychologists, from psychiatrists. And also they should be like a role model that seeking mental health is not a stigma, and we can all, it is like asking for pure medical treatment. So this is another part of medical services that changing the culture, involving leaders, stakeholders, also is very important. Also, one of the things also engaging also the others, like engaging nurses, engaging trainees, a young physician, engaging everybody to be advocate for mental health at work. Hold management accountable, foster inclusivity and belonging. These are some strategies. So to prevent, first to prevent, to reshape work environment, to minimize psychological risk and prevent workers from experiencing mental health conditions like psychological risk management or organizational intervention, protect and promote support. Also, those are some strategies. Other also conduct needs assessment, determine what organizational drivers of burnout. There are many scales of burnout that have been used. So choose the proper one. Try to choose a scale that is not too long, because you know, as the your survey questionnaire became more long, maybe the response will be less. Choose the proper one. Make sure that it has a validated version in your language. Or if they can use the English one, so you can use the English version. Make sure that they understand your questions will include as much as demographic and other social factors as possible, because sometimes you might find, for example, one of the causes of burnout, they found that if your time from your home to your work and back more than 60 minutes, it will cause more stress. So this is very important. They might help to modify some of the policy. They might help to either to give a flexible schedule or to work from home. So this is very important to include. Also to include, for example, stress scales. There are many stress scales in the literature, so you can use a proper one. Some of them they have short version, 2 or 3 questions. Some of them they have very long. Also to use some scale that tells you where is the not only the prevalence of burnout and what is the drivers of burnout. So what caused this burnout? Also, you should include in your also survey what is the impact. Does it have impact on productivity? Does it have intent to leave work? Does it have impact on like violence and muscular pain, sleep? All these things should be included in your survey. And your survey should be based on a framework. So after your result, you will analyze the results, so you can provide this kind of information to your management, higher management, to convince them that, okay, this is our numbers, this is the prevalence of stress, this is the prevalence of burnout, this is the impact, this is the driver. So this how, and you offer some solutions. This is examples of organization versus individual strategy to address burnout, like strategies targeting organization process and culture, practice, delivery, implementation, workflow modification. And it has been said that workflow interruption is one of the most important factors, drivers of burnout. And as you know, electronic health records has been considered one of the main causes also of burnout. Institutional policy change, like time to leave, time off and leave policy, leaves for people with special needs, leave for pregnant ladies, nursing time, a lot of things that should be modified at the institutional level in their internal policy. Organizational culture change, and we just talk about that one. Expanding resources for staff, for example, to have some online resources, or sometimes for education and awareness, but also resources to support for, like, for example, childcare. I remember one of the institute here in our country, they created like a childcare for the employee women, ladies who have some kids, so they are bringing their kids, put it in the childcare in the same institute. When they leave in the afternoon, they take their kids, so they have more productivity at that one. Individual level strategies. stress management, resilience training. This is very, very, very important. A lot of our colleagues, they don't know how to manage their stress, how to be resilient. You might see two trainees or two healthcare provider under the same department. One of them has burnout or stressed or anxious, and the other one is not. It is the personal factor that should we have to foster or promote resilience. Self-care tools, mindfulness practice, which is, mindfulness has a lot of studies and evidence-based, and it has a great impact and outcome. Professional development training, it is lack of capacity and lack of skills, lack of training, one of the reason of burnout among some or I can say a good number of healthcare providers. Sometimes they might, for example, one of the subspecialty, they have some specialists and they reported we lack some skills to deal with patients, to give them some session. So professional development training is very important, will increase or improve their confidence and the work performance. Somatic therapy, if they have some pain as a consequence of this stress, somatic therapy is very to have a somatic therapy. What's the impact of organization intervention to address burnout? So they will have reduced burnout, improve work-related attitudes, morale, job satisfaction, organization commitment, stress. Also, you will improve the client satisfaction. Improve organization culture and climate, role conflict, effort reward imbalance, and organization rigidity, psychological demand. What managers, leaders can support others by work-life balance, workshop on life-work balance, how to manage your your life, your home, everything, and how you have different domains in your life, like physical, mental, work, financial, social, your family, religious, all these things. It has to be balanced, and it shouldn't be one at the expense of others. I shouldn't work without taking a leave. Okay, maybe I will be successful in my work, but it will affect my health. I have to take care of myself also and my health, to go to the gym, to do exercise, to meet my friends. Respect, clarity and expectation, growth and development, involvement and contribution, opportunity, and fairness also, physical safety, protection, psychological protection, social support, recognition and reward, which is very important. And reward and recognition, it should be according to their nature of job, according to their rank. Some of them maybe you can for example, give them some appreciation. Some of them they might have bonus or whatever, any kind of recognition. So it's different. So one size doesn't fit all. Social workload, also management. Also modeling healthy psychological behavior, building connection through check-in, be flexible and inclusive, do not take assumptions, communicate even more, invest in education, which is very important, over accommodation and modification, develop appropriate metrics. Remember, happy organization is successful organization. Thank you very much, and we'll leave time open floor for questions.
Thank you so much, Dr. Saoud, for the presentation and for an amazing information that we received from you. We really appreciate it. For questions, I guess we can leave our questions for the Q&A, and we can go through it. So, Dr. Saud, during the time that maybe we could receive some questions, I'll jump in and ask you some.
Yeah, sure.
Yeah. So, you talk about DAAM and the program of DAAM, and I know that you started like years ago. What is the most difficulties you faced during that development of the program?
Okay. Okay, this is a great question. Maybe at the beginning, when we started first in 2017 as a proposal and an idea to, it was welcomed and accepted by Saudi Commission for Specialties, but still the concept was not mature to some of the healthcare providers, especially the trainers. They think maybe this is not necessary, this is luxury, this is and also for the trainees, it was the one of the issues that they thought about the confidentiality and privacy. They said, okay, is it confidential? If, for example, I apply through the web Saudi Commission, would it be confidential, or some of my program director will have an idea? So this is one of the issues. We overcome that by raising awareness among the trainer through train the trainer workshop, through a lot of campaigns, and also with trainees. Also, we raised awareness. We explained the process, complete the process from the time they apply for the request for the support till the end of. And you know, with time, like more word of mouth, they start to spread the feedback from the trainees. So recently, we are receiving requests, and they usually, when you ask them how did you hear about DAAM, they said, yeah, we hear about DAAM, but one of my colleagues encouraged me to see cases because they already got this service. Some of them, they say, my father asked me to go to DAAM, even their father is not in the profession, in the medical field. So yeah, this is one of the difficulties.
So I believe that these programs needs to be developed well, and it needs time to gain the trust of the beneficiaries.
Sure. Yeah. Sure.
Okay, so I'll go back to the questions. Seems
I think there is one hand raised.
Yep.
If our colleagues in IT, if they can,
Yeah,
allow,
they can unmute if there is any participation. Okay, can you, yeah, for questions and comments, maybe you can raise hand so I can unmute you, for the participation. So the hands now will raise down, then we can raise it up by you. So during the time, Dr. Saud,
there is two. I think there is hands.
Yeah, we unmute them, but there is no no comment. So until we received, Doctor, I will ask you. I know you have an experience with the mindfulness, and it's very clear that there is a related between mindfulness and well-being. From your experience, I know that you are practicing mindfulness for a while. Could you give us a hint about it?
Yeah, actually, mindfulness is one of the techniques and modality to help to healthcare provider and even non-healthcare providers to take care of their health. So it is paying. It is defined by John Kabat-Zinn as paying attention to the present moment. In a particular way, non-judgmentally. It means that I'm connected to myself, to my emotions, to my thoughts, moment by moment, without any kind of judgment. Just I'm observing what is arising within me, or even the environment outside me, without any without labeling, without giving them any like particular point of view, just to remain observing and without any judgment. Such practice, with time, it will help to, there is a lot of change at the gray matter, at the basal ganglia, at a lot of areas at the brain. So it will help sharpening your attention, sharpening also or increasing your compassion, decreasing level of anxiety, decreasing also your emotional reaction. Also, it will help you to look from another different way, different perspective, others' perspective. So your emotional or your reaction, it will be instead of overreacting or instead of automatic reaction, so will be proactive or not automatic reaction. So I will stop, observe, then I will either to respond, or let it go. So this is basically, it is very, very helpful. I do it at personal level to my clients, to my patient in the clinic, and the benefit is actually great, even for physical pain.
Thank you, Dr. Saud. I'm just going back to the Q&A section. We have Lemia. Lemia said that I used to work in a hospital where I had a stress management clinic for employees, but then it was terminated. She asking, like, is it mandatory for the HCI to provide mental support for all of the employees?
Let me, I'm just reading the question now. So I used to work in the hospital where I had stress management clinic for employees, but it was terminated. Is it mandatory for the, I don't know what she means, HCI, to provide mental health for all employees. If she can clarify what is HCI, but what I know, here in our country, they start to have like burnout clinic. It is there, but some of the hospital, they have it like voluntary, and some of the hospital they don't have it yet. I think one of some of the hospitals start to have not just a clinic, but that is a well comprehensive program.
Okay. Also, Madiha, she has a questions. Go through it. Is it clear, Doctor?
Yeah, so she said when you are at the managerial position and you experience burnout being a higher authority, it is difficult to manage. So how should you cope with that, not to forget that they're more worried about their image? Yeah, so we mentioned that healthcare provider in general, they are reluctant, and maybe also the managers, they are reluctant to seek help because they might concern about their image, and this is it happens in many places. But remember that I think to take care of ourselves is more important, and sometimes we don't. Some of those managers, they don't take care, seek help in the same hospital or the same institute, so they might go to other hospital. But remember, taking care of yourself is much more important than maybe others' or opinion about you or about the image, because sometimes if we neglect this part or this area, we might end up with a more difficult situation, or sometimes you might give up or resign from our work or leave that position. If maybe I give this advice to some of my colleagues, if this position is putting a lot of pressure on your health, so your health is a priority. Some of I know of my colleagues, they were in like manager at some places, but they couldn't tolerate the amount of work or workload or stress. So some of people, they don't know how to manage. So your health is a priority. But if you can learn some of the coping strategies with well-trained mental health provider or psychologist, I'm sure it will help you a lot. Also, to learn some skills like, for example, mindfulness, relaxation therapy, yoga, and physical activity. Again, I'm emphasizing on physical activity because it has a lot of change, even some structural changes in our brain. Then also one of the mindfulness, as we just talked about. The last thing, if you cannot, I think it's very important to seek help with either psychiatrist or psychologist to help you to cope with these stressors. So the bottom line is, please don't cannot say neglect yourself, but please your health is a priority. So it's very important to pick this. If you recognize it, if you can manage it by yourself, okay. If you couldn't, seek help from a specialist.
Perfect. So we are almost done, Doctor. I just want to say that on behalf of the Saudi Patient Safety Center, I would like to thank you so much for an amazing topic. And also I would thank you, our audience, for joining us. And I just want to remind you about the evaluation survey that will provide it to you. And it's very important to continue our sessions and workshops with you. Thank you again, and I wish you all of the best, and think about your health. Thanks a lot.
Thank you. Thank you, everyone.